paper found COVID-19 could cause distress through the loss of employment, loneliness and homelessness.
This is hurting people, not just in terms of I don't have enough money, but it's hurting people in their mental state, in their lives, in so many ways.
A report co-authored by Wesley Mission makes recommendations to address the needs of people during and after the pandemic. They include a call for suicide prevention training for frontline Centrelink staff. Suicide Prevention Australia's CEO, Nevis Murray, says the government must also soon announce an extension to JobKeeper.
The reason being that the longer we protract that decision, the more distress that people who are in those circumstances will experience.
Those economic downturns lead to distress for people and communities, and we know for a fact that that level of distress results in increased risk of suicide.
Welcome to this important occasion when we're meeting together to engage in a conversation about a very important subject at this point in time. But before we share in this webinar, I want to acknowledge there are lots of different locations that we're meeting today, and therefore the land on which, wherever people are meeting, listening or viewing this particular webinar, we recognise the First Peoples, and we recognise at the same time the respect that we hold for them and their elders past and present. But I also add to that a special acknowledgement of those people for whom suicide and mental illness is a lived experience. And so this isn't just something that we're talking about and recognising that we're talking out of something that is foreign and strange to people's experience, but very much part of that experiences. Your voices, your presence and your sharing with us is important. The paper is an important paper, and we've acknowledged the paper in terms of reducing distress. Lots of people, when they talk about the subjects that we're talking about today, think of it merely in one particular area of mental illness. We're recognising that mental illness and suicide is affected by a whole host of community activities and events that are going on in the community. Joining me today is Christine Morgan, National Suicide Prevention Advisor to the Prime Minister and CEO, importantly, of the National Mental Health Commission. Good to have you here, Christine.
Thank you.
And also at the same time, Rebecca Burdick Davies, who's with us, Director of Policy Advocacy and Government Relations for Suicide Prevention Australia.
Thank you, Kate.
Suicide Prevention Australia and Wesley Mission have partnered in the presentation of this white paper. Our intention is to begin a conversation. It is to make people aware of the issues that are so important in relation to distress in our community, and our intention to seek to reduce that distress in the things that we're about. We've partnered together to produce this paper because we believe it's best talked about together, and a partnership of the kind that we've engaged here is certainly something that's important in the light of the present pandemic across Australia and indeed across our world. So we're talking about COVID-19, obviously, and the effects of that and where we are at this point in time. So Christine, I'm going to ask you, first of all, there's no doubt that this is a watershed event. None of us sat here could have imagined what this is going to be like. What do you think, if I were to ask you the question, how are we faring, do you think?
Oh, look, what a good question. What a good question. And I think it's really relevant to be saying, how are we faring at the moment? Not just go back to, say, February, when it all started, when we were all sort of in this cataclysmic, my goodness, we didn't even know what was happening. So how are we faring? We are faring still in circumstances which give us really heightened anxiety. That anxiety may have shifted a little bit for some of us from being really frightened about our physical security, though some of that's coming back with what's happening at the moment with further restrictions coming back in. It's very much around our economy, it's very much around our livelihood, it's around the future for our children. It's anxiety, Keith, it's really getting to us. And I think that whether we came into this with mental health challenges or not, I think it would be hard to say that any Australian mental health wasn't affected.
You've just mentioned some of those things like economics and issues. I think that's one of the important things, is not just to put this in a box and say we're just going to talk about this as though this is a health issue.
That's right.
Or it's all of it, isn't it?
It's all of it. And I think that was one of the cataclysmic things about it, that whilst it was an illness that was affecting us, the way we had to manage it, the way we had to respond to it, has had this effect across every part of our lives. You know, the way where we live, how we work in those places, how we work with each other, how we interact. I often say, Keith, we came off the bushfires in January, and the palpable lesson from that everybody said was we want to connect with each other. We want to be really close. You know, we relied on our neighbours, and there we were 2 weeks later, stay away. So just how we even grapple with that is pretty amazing.
And I suppose the question that I just want to conclude before I turn to Rebecca in her particular area is, how do you think we're faring in terms of a new danger that's around? Do you think, have we got a bit too lax about the whole thing?
Look, I don't know if we've got lax. I think we've been reminded that this is not something that we can necessarily eliminate at this stage. I think we're faring in a number of ways. I think that it is certainly, for some people, brought out new depths of resilience, but for many others, it's also brought out, I don't know how to do this. And I have heard from so many people that they have had to reach out for the first time to others. And the way we enable that, the way we respond to that, is so critical in terms of being able to help people find the ways and the strategies to get through.
Rebecca uses a different kind of word with the same interest and concern. How do you think we're dealing with it? Do you think we're dealing with it well?
Well, I think it's difficult to give an assessment, because it's just, as Christine mentioned, this is a black swan event. We've never seen a crisis like this before, certainly in my lifetime, but I think within the lifetimes of most Australians now. I mean, obviously there's Australians who've lived through world wars, but this is a pandemic that we haven't seen since the Spanish influenza, which was back in the 20s. But I think there's a lot of things we can be proud of in Australia. So our government, first of all, really sprang into action a lot more quickly than governments internationally. So we had a coordinated public health response, and we can see that with the way that COVID-19 caseloads are being managed. And we had an incredibly coordinated response from a mental health perspective. So we're very privileged to have Christine here to speak with us in this discussion today. We saw the entire government and mental health sector swing into action to ensure that people had a number of different options to go to for support. So I think there's a lot to be proud of in the way that we've responded. But I guess if I reflect on the reasons why we embarked on this report, we can't sort of be static in the way that we've responded to this situation. And I think coming from the perspective of Suicide Prevention Australia, as a national peak body, we thought, well, here's an opportunity to inform government or perhaps inform some of the considerations for government in the next few months. And I think it's these next few months that will be really critical. That was a flavour, I guess, of the research that we reviewed as well from previous pandemics like SARS and H1N1 virus. The first few months of the pandemic, people really came together in the community and came together as one. It's those months afterwards where some people feel the most acute impact, and that's what we want to assist and support.
And we're glad to work with you. And one of the areas that we've been involved in is setting up a whole host of networks from
That's
Wesley
right.
Mission across the country. And one of the things that's certainly true is that people have had to deal with this issue in the locale. They've had to deal with it in isolation, not just an individual isolation, but organisational isolations as well. And so that's been a great, it's good to work with you guys. Do you expect things to change in the coming months?
I wish I had a crystal ball, but of course things will change, because, I mean, we've just seen, I think 3 weeks ago when we thought of the title for this report, which is perhaps not as apt as it was when we thought of it, we felt Australia at least was emerging from the pandemic, like New Zealand did. I think New Zealand's basically eliminated COVID-19, and then we've seen the unfortunate situation unfold in Victoria. So I can't really forecast where we're going to head, but I think from the perspective of reducing distress, we can expect, I think quite confidently, this is what our economists are telling us across Australia, we can expect there to be some impacts on business, we can expect there to be impacts on people's jobs, and I think that's a critical concern for Wesley Mission, who we were so proud to partner with on this report, and it's certainly a critical concern for us, because we do know there's a relationship between people's well-being and their security of their finances and employment. So I think we can forecast that.
I'm glad you've talked about those things, because I suspect, Christine, your answer to this question would relate to whole of government, really. And, you know, not only states coming together, we were last discovered, you know, it doesn't matter if we've had historically different railway lines, this is a very important together moment, isn't it, really?
It really is.
And looking forward, how do you see the good coming out of this in terms of whole of government response?
The first thing I'll say on that is that the national cooperation is, I used the word before, palpable. It's palpable in Canberra, but also whether you go up to Macquarie Street here or Spring Street down in Melbourne, it is palpable. People are saying, how can we come together? With what's happening in Victoria, it's very much about they're our colleagues. They're our colleagues. How can we actually help that? So I think that sense of not only we can come together, but by coming together, picking up on your point, Rebecca, it has enabled the government to have a really coordinated response. So I think that's the first thing, Keith. I think the second thing is a new sense of agility. Instead of kind of stumbling over all of those blocks we have in our federated Westminster model about how do you get decisions made, we're saying, actually, we've only got 24 hours to make this decision, if not less. So let's just do it. And so I think that agility has come. So when we were putting the pandemic mental health and wellbeing response plan together, which brought all 9 jurisdictions together, that sense of being able to do things differently was really critical. And the third thing, and I think this has been really good for mental health in Australia, is that we've looked over the parapet. We've said we're no longer just going to wait for people to come to us. We actually need to go to them. And in suicide, as Rebecca and yourself would know, I mean, half of the people we unfortunately lose to suicide have not been in touch with mental health services. So there is that imperative for us to say, let's not wait. Let's actually get out there and meet people with where they're at.
Christine, over the years, we've known each other and we've seen the development of the way in which people have talked about suicide more openly now than they used to be. I can remember only 15, 20 years ago when you talked about this with the media and journalists, and they would say, the voice would lower, and they would even say to you offside, I'm not sure we should talk about this. Well, we should. And I wonder if, in fact, coming out of this might be some more openness about this important subject that we've still got it.
You are so right, Keith. It is so critical. I think it is. We need to acknowledge that we lost 3,046 people, as we all know, in 2018. But how many more people attempted in that time? So how many families? And if you look at it, about 130 people, we estimate, are impacted by every suicide. So this touches people. I think one of the critical things, though, is, and I think Rebecca would agree with me on this, is that not only do we need to talk about it, it's how we talk about it. And I think we need to really move away from the alarmist. I don't think that gets us anywhere. I think what we need to do is to talk about it in terms of normalising it, saying suicide ideation is a lot more common than we give it credit for, and really putting out there that message of hope. Because it's when people lose hope, as we know, that they reach those crisis points. So it's about how we talk about it. It's about saying, yes, we need to normalise it, but we also need to couple that with a sense of suicide's not inevitable. It may be a lot more common, and suicide ideation is certainly a lot more common than we would want it to be, but suicide is not inevitable, and that's a really critical message.
Rebecca, the white paper rightly points to areas other than what we would traditionally call mental health areas and suicide, and that's been purposeful, isn't it, in the report?
It certainly has. It really goes to the heart of, I mean, Christine has talked about this, about a whole of government, whole of community approach to suicide, and that, if I think of a reason for being for me and for the policy team of Suicide Prevention Australia, that's it, to drive or to try and influence that approach. I think that Wesley Mission has and brought an incredible amount of credibility. You've got hundreds of years, or a couple of hundred years, of delivering services to people in communities across Australia. And that was really fantastic, because it meant that we had on-the-ground insight into the things that are affecting people right now. And what we heard from Wesley is People are being affected by feeling lonely. People are being affected by issues with drug and alcohol. People who are homeless are, of course, feeling the impacts of COVID-19 acutely. But I will turn to Christine's point, which is about positivity and sharing messages of hope, and that's really what this report is designed to be. We didn't want to strike fear in anybody's hearts. We didn't want to make predictions about increases in suicide, because that is the last thing that we would want to do. What we've, I guess, tried to do is say, government has this wonderful National Mental Health and Pandemic Response Plan. Here are some additional things that governments might consider as they implement that plan, and here are some things, here's a way for us to approach suicide prevention which really gears up everybody in the community. It makes suicide everybody's business in a positive sense, in that we all want to prevent suicides from happening.
And also gives us the, it's not the right, but the privilege of being able to talk about those issues such as finance, homelessness.
That's right.
All the things that we know are part of the story that's knocking on the door at this particular point in time. And that's why I'm pleased that this is about a partnership. And I think this doesn't give us opportunity to bang the drum. What it does do is say, look, here is the issues. It is an all-of-nation issue. It's an all-of-people issue, and there's hardly anybody not affected by it in some way or another. So let's move on to the tricky stuff, because it is tricky, really, talking about economics and talking about well-being. And there's a lot of people making speeches about, you know, this has got to happen, this has got to happen, from left and right in terms of politics. All of us know that really there are issues about economics, and the National Mental Health Commission is aware of that as much as anybody else. Do you have any comments about how businesses and workforces can thrive even in conditions like this?
That is a really hard question. I knew you'd throw me a really hard one, Keith, and that one is how businesses can thrive. I actually think that if you strip away the bits that business does, you know, what their business is, it actually comes down to their people, doesn't it? It comes down to, there is no business, even in the digital age, that can exist without its workforce, without its people. So I think if you're really looking at how a business can thrive, I think it really does come back to how are the people who are working in that business themselves participating, managing. I think workplaces are a critical place for us to be looking at mental health and well-being, and looking at risk of suicide and suicide protective factors. It's critical. And we now have a diversity of workplaces, of course, because people are working from home and working in different places. But I think that would have to be the answer, Keith, that if you're really looking for how your business can thrive, it really comes down to saying at the end of the day, it's about your people and how are you working with your people and helping look after your people.
And if I go to a factory or I go to a business, an office, we have the person who's the first aid person.
Yes.
If there's a fire goes off, if that goes off. But should we not be saying we need to have people looking out for people's mental well-being in the workplace?
And that's a big piece of work we're trying to do. So the federal government has funded what we call our National Workplace Initiative that we're working on, and that really is to try and say, how can we make any workplace, whether it's a sole trader or whether it is one of our multinationals, how can we actually introduce this concept of mental health and well-being? And I think it's not just looking at how can we stop people becoming mentally unwell, but I think a really foundational piece for our nation, Keith, for our families, our communities, our nation, is that if we actually invest in our mental health and well-being, we unlock our true potential. So I think it's actually not just about how much money are we spending on fixing the problem, it's actually how much are we prepared to invest in mental health and well-being as the truly foundational piece for unlocking where we can go as a country or as a community or as a family or as a business.
And coming back, Rebecca, to your core purpose as an organisation, a peak body, working with people like ourselves, coming back to suicide quite directly, what are the economic concerns that you have in that particular area?
I guess, Keith, are you referring to more broadly what are the economic concerns around suicide, or right now what are we concerned about?
Both of those. Let's take the first one.
Let's take the first one. So taking a broad perspective, we know from previous recessions, including the GFC, that they're particularly in industries that have been hit hard and where there's a loss of jobs, where there's businesses shutting down, that there has been an increase in suicidal behaviour. So that's borne out by the evidence. That's something that we found during our literature review, and there's people who are far more highly qualified and trained than myself who have drawn those conclusions. I think in relation to this crisis, it's similar. COVID-19 is a public health issue, but it's having ramifications for the world economy. We're not seeing that free passage, and my background is business policy, so it's something I'm keenly interested in. We're seeing the free passage of goods and services somewhat hindered. We're seeing people, whole industries like tourism, for example, international tourism, grind to a halt. So of course that's going to have an impact on our economy. And if we're drawing from the experience of those previous big financial crises, we shouldn't be predicting, but we could foresee that there may be an impact on suicidal behaviour. And I think that's the perspective we're coming from at Suicide Prevention Australia. We know that governments have to strike a balance. So governments have to strike a balance between fiscal responsibility and supporting workplaces and businesses. We live in a free market economy. Businesses also have their own, concern to keep themselves thriving and going. But I think in a crisis like this, where situations like border restrictions are happening and industries are being drawn to a close through no fault, well, not fault of their own, through no action of their own, we need to see a targeted response. And that's why I guess we've said to government, JobKeeper, of course, is not something that you can sustain forever, but perhaps it could be a consideration for government to think about continuing a targeted version of JobKeeper past September. That's one of the things we've asked to consider. And then in relation to JobSeeker, the coronavirus supplement is a significant supplement. We haven't asked for that supplement to continue wholesale, but we are saying, can government consider raising the base rate of job seekers so that people, people who haven't seen a real increase to that support, I think since 1994, there hasn't been an increase in the base rate. People can see that support increase. And I have to say that it's not just Suicide Prevention Australia saying these things. The business community has swung behind these calls to action. So we're really piggybacking on some of those big voices that are out there already in this space.
In my own area, Wesley Mission, I'm very conscious that words like isolation and distancing, I never thought we'd be using these words with the rapidity that they appear in programmes and conversations and articles as they do today. But all of those things are factors that certainly impact upon people's mental health, and certainly they are issues that are very real. I'm often, when I go around the country and meet people with setting up new networks, you look at the situations that might, shall we say, not encourage, but create the context in which some of these difficult things that we talk about happen. And isolation is one of them. And if we're living in a community now where we're telling people, stay apart, don't do, all those things are really, and this is the difficult one. When we say to everybody, just stay with your family, the family is often the place where some of this stuff is at its worst. That's in terms of aggression and lack of so maybe some good things we hope will come out of it. What about, this is a question for both of you. I'll start with you, Christine. What about the role of the media in all of this? Because, gosh, there's been some good media, I have to say. But there's been some shocking stuff as well, really, and we won't identify the papers and the places, but they've got an important role to play, haven't they?
Media have an absolutely critical role to play. I think that I see it in two ways. I see, firstly, they are our social barometer. They know what will garner interest, what people will want to talk about. So they are our social barometer. They do create conversation. Whatever means of media we're talking about, whether it's social media, whether it's print media, whether it's TV, film, whatever it may be, it is an opportunity to create conversation. It's an opportunity to influence people. And I think probably now, more so than at many other times in history, that responsibility, I think, is something that really needs to be acknowledged. And yes, they can and should provide a range of views, opinions, etc. But I bring it back to suicide prevention. We know that probably the most challenging thing for us to deal with, for those who work in trying to help people avoid those crises, is to not have alarmist conversations happening. So I think that is but an example of it. So I think it is critical. I think that some people are are sceptical and they will go searching for truth. Others will actually believe those sound bites. And so I think there is a really heightened sense of responsibility, Keith, in the media and how the media sort of absolves itself of that.
The right use of language is so important, isn't it? I've spent 15 years trying to have interviews about suicide and say, please don't use the term commit suicide.
That's right.
And we're still doing it now, after all these years. So we've got a big task on our plate, I think, really, but we mustn't give up on it. I think as people get it, they do get it. You really get it once you get it.
Well, you do, don't you? But I think you're right, and I think that the one thing media can do is to be really conscious of the language it uses, but I think it can also, there's a long way to go towards destigmatising. And that's another area the media has such a key role to play. So it's not just what they do, it's how they do it, which I think is critical.
And the voices of lived experience is important. When we've had events where we've asked people who have lost loved ones or been themselves on the point of taking their own lives, bringing their life, which has been to that point important, to a close, you realise that lived experience and families, are so powerful in terms of trying to provide a positive voice in the middle of it all. Have you found that yourself as you've talked to the many agencies?
Oh, absolutely. It's certainly, the voice of lived experience needs to be at the centre of any conversation about suicide prevention. So I have to say it would be fantastic if we had someone here with us today to share their story of lived experience, because it adds so much power and weight and realness to anything that we say about suicide. There was a terrific piece in the ABC the other day that shared the lived experience story of one of our own ambassadors at SPA, and I think he's also worked with Wesley Mission in the past, Graham Holdsworth. He shared his very powerful story of lived experience, and he was someone who experienced financial distress, relationship breakdown, all those interconnected problems that we know can lead someone down that path. But going to your earlier point, Keith, around the role of the media, safe language, responsible reporting. One of the surprising things we found with conducting this paper is we commissioned an independent analysis of media, and we found that, of course, there was some negative coverage. I mean, absolutely, that's incontrovertible. But coverage, a significant proportion of coverage was either neutral and surprising amount was positive. And we found that a large reason why that was the case is because government had been so proactive in Australia with sharing and promoting fact-based sources of advice. So things like the COVID Safe app, things like the Department of Health website that were just up there and running and available to people. And that's what we also found with other pandemics, that in the Netherlands, for example, where they didn't have access to similarly fact-based sources of information, the media engaged in much more dangerous, scary and heightened discussions about the virus and also about the mental health impact. So I think I'm trying to, share another positive message, which is our media is doing not a bad job during this crisis, and that's in large thanks to the sources they have.
In any pandemic, there are ways in which we can respond creatively to what's there. Now, I know that initially slated to end in June 20, the Australian government's response to suicide prevention trial sites was an important... Do you want to tell us a little bit about what they are, Christine?
Yes, so thank you. So the trial sites, and people may be amazed to know there is actually 30 trial sites around Australia now. And what we're really looking at there, and it's a combination of some of the trial sites are running what we call the lifespan model and some what we call the European Alliance model, or some variants of it. What we're really looking at doing is to say, look, we know we've got the models of suicidal behaviour, Joiner's model and Kane's model and Rory O'Connor's model of suicidal behaviour. We know we've got evidence-based interventions, but we need to really look at what does that look like in terms of regional community settings, and they're really interventions which are coming from a combined perspective of health, mental health and community-based. So how effective are those trials? And I guess two questions we're particularly interested in is to say that all of them have different components, whether it's 8 or 12 different components, and we're really interested long-term in saying what of those components are really critical. And really importantly, I think, for the work we're trying to do in the task force is what does a community need to have in order to enable it to actually bring those interventions into place? So they're really trials to say, if we try and empower the community more effectively with evidence-based interventions, can we actually move upstream and prevent those suicidal crises?
And the last time we talked about the First Peoples amongst Aboriginal Torres Strait Island. It's an important area there, isn't it?
Critical. Absolutely critical. So again, we know that if we're really going to reach anybody, you need to do it on their terms, not our terms. That's an absolute fundamental. And so if we look at our First Nation people, if we look at our Indigenous communities, they need to be integrally involved in identifying what would work for them and how to actually implement that. And it is a crisis for them, and it's one that they grapple with so strongly, and it's heartbreaking, Keith. It's absolutely heartbreaking. So that is a critical area. We know that suicide death rates for our Indigenous people are twice the rate, and it's a leading cause of death for young Indigenous people. So that's one of our critical points.
We're coming towards the final few minutes of our conversation together. It's good that we've been able to have this conversation. It's been good for Wesley Mission to be able to work in this partnership with yourselves. What are the things that we can learn from a project like this?
Well, I've certainly learned a lot personally about collaboration. I think Suicide Prevention Australia, our whole reason for being, I talked about reason for being from a policy perspective, but our reason for being as an organisation is to voice the needs and the ideas and the priorities of the suicide prevention sector. So I think this report is a real example of what we should be doing more of. From our perspective, I think I learned so much partnering with Wesley Mission because of your incredibly long history in working with people in all different scenarios of life, whether they're homeless, whether they're veterans needing support, whether they're looking for a job. So it was just incredible to be drawing on such a rich source of intelligence and partnering with people who really understood what the issues are in the community. So I can read and digest literature just like anybody else, but I'm not working directly with those communities. And I was very privileged to be able to work with people who have had that experience. So I have to give thanks to James Bell and his team, who were my partners in this project and our partners in this project. And as I said, yeah, the key learning I think for us as an organisation was we need to work with all of our members, of course, but particularly with those members who are working intimately with the vulnerable members of our community, because that's who we're here to help.
But Rebecca, the helicopter matters as well, doesn't it? To be able to look down at a panoply, a picture of what's happening in the area. So thank you for working together. Christine, any final thoughts from you?
Final thoughts. I think, firstly, I would say on mental health. And I think the pandemic is really bringing this home to us, and it was brought home in the bushfires as well. Our mental health is as much a part of our humanity as our physical health. It is something that we all own, and it is capable of being affected. That's the first thing. So I think recognising that, and recognising that just like we look after our physical health, we need to look after our mental health is really critical. When it comes to suicide ideation, suicide crisis, it really is, unfortunately, a lot more common than many people believe. The first step, the most fundamental step, is connection with someone else. You talked about that you had never had so many conversations around distancing. I so agree with that, Keith. And what we tried to do at the beginning of the pandemic was change the reference to social distancing. Absolutely. So we called it physical distancing with social connection. Yeah. And as I've worked over these last few months, I think the thing that has come home to me so strongly is the power of social connection. That if we find the way to stay connected with another and we can have hope, then there is a way through.
Well, thank you for sharing with us. We've covered a large amount of material and a large area of work in what we've talked about today in our conversation. It's probably what we want to be saying. It's a whole of community response. Organisations delivering services, those people seeking empirical and evidential ways of looking at this, and government who have the job of working out from that level. It's all of us together. you know, that song that talks about us all in together, I mean, it had gone off the charts. I mean, nobody had listened to it. Everybody's singing it now, aren't they? Because we are in it together.
That's
and
right.
if it's going to be done, anything that's there. So thank you, Christine, for coming along and sharing with us and back on your old stamping ground, as it were.
Absolutely.
At Wesley Mission. We're delighted to have had you with us, and not only your work with government, but the important work that you do in the organisation that is part of your particular heart, and also to you, Rebecca. Thank you ever so much.
Thank you.
And if you've been watching the programme, and if in any way you've been affected by the conversation, we want to be able to offer help to you and to say to you that you are not alone, that there are people out there that want to offer care and concern. I particularly want to express thanks to those that are here, but thanking those of you at home that have taken the time to share with us in this particular programme today. Thank you to all our viewers. We want to encourage you to continue the discussion online, in social media. Spread it wherever you can, because the more we talk about it, the more we might be able to find positive ways forward together.